From the American Academy of Pediatrics.
A new national primary drinking water regulation from the EPA calls for protection from PFAS.
The so-called forever chemicals have very tight bonds that don't break down.
And this is why they persist and are what we call POPs, or persistent organic pollutants.
Plus, new research looks at how positive childhood experiences affect children whose caregivers are incarcerated.
The reason why I particularly decided to focus on parental legal system involvement, specifically incarceration and arrest, was that this is an ACE that disrupts attachment.
These stories and more on Pediatrics on Call, the podcast on children's health from the AAP. I'm Dr. Joanna Parga-Belinkie.
And I'm Dr. David Hill. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well. Let's start today's episode with a conversation about per- and polyfluoroalkyl substances, or PFAS.
David, you had a pretty cool experience recently. President Biden visited Wilmington, North Carolina, and you were there.
I would never miss a chance to see the president in person. But I have to tell you, I was also geeking out because he came with EPA Administrator Michael Regan, a native of Goldsboro where I work. Michael is a leader in the fight against per- and polyfluoroalkyl substances, or PFAS. Sometimes people call them forever chemicals. They've been a huge issue here in Wilmington, where our water was badly contaminated for decades.
Can I confess something? I don't know much about these PFAS chemicals and how they affect kids' development.
Hey, I didn't either, but I've had to learn some living here. I'm still no expert. For that, we need someone like our next guest, Dr. Alan Woolf, professor of pediatrics in the Division of General Pediatrics at Harvard Medical School and director of the Pediatric Environmental Health Center at Boston Children's Hospital. We talked to him about well water in episode 145. Dr. Woolf, welcome back.
Thank you very much, David and Joanna. It's a pleasure to be with you this afternoon.
Alan, can you start just by telling us what these PFAS chemicals are and why they are in our environment?
Well, PFAS chemicals are a group of chemically similar structured molecules, upwards of 12,000, although just a few are used in commercial enterprises. And as David mentioned, they are per- or polyfluoroalkyl substances. So they all have a carbon chain with side groups that are mostly occupied by the element fluorine. And they were discovered in about the 1950s and back post-World War II, when consumer goods proliferated and the baby boom generation was getting started, and new miracle products were being invented. In fact, the era was known as better living through chemistry. And that's when PFAS were discovered and found to be very useful in commercial products because of their properties. They slip and slide. They repel both water and oil, and can be used to coat items or to be added to plastics to improve their consumer properties. For example, Teflon, the nonstick coatings on frying pan that used to be so popular, were PFAS chemicals. That's what the coating on those frying pans was, that allowed you to fry eggs and they'd slip right off. PFAS were also used in waterproofing tents and camping equipment, waterproofing shoes and clothing. They were used in turnout gear by firefighters. They were used in so-called AFFF, which is aqueous firefighting foam, which was used by many military installations around the country in practicing to put out airplane fires. So these chemicals have been pretty much ubiquitous over the past 50 years.
And what makes them forever chemicals?
Well, that's a very tight bond between fluorine and carbon. And that's what made them very useful, in that it gave those molecules these physical properties that were so attractive to the chemical industry and consumer products. But it's a tight bond so that in the soil or in water or in waste materials, in toxic waste sites, or in other bodies of water, including the ocean, that tight bond is not broken down easily in nature. And this is why they persist and are what we call POPs, or persistent organic pollutants.
So we've established that we should be a little bit worried about these pollutants, but exactly how worried? What kinds of overall health effects are we seeing as these chemicals go into the environment?
It's a great question, Joanna, and we're still researching it. And for example, in children, we are concerned about PFAS effects on the immune system and perhaps blunting children's responses to vaccines. There's some research that indicates that that can happen, and it can also affect adults' response to common immunizations as well. So that's one concern, is the immune system. Another is the system of metabolism, including lipids and cholesterol. It's been found both in children and adults that populations that have higher PFAS levels also have higher cholesterol levels, and a condition called dyslipidemia, and that is changes in their lipid concentrations that put them at more risk for health effects such as cardiovascular disease. In adults, there have been concerns about the relationship between PFAS exposure and thyroid function, and whether these chemicals can also be what are called endocrine disruptors. And that is that they can affect the function of thyroid and other hormones. And along those similar lines, there's some research being performed by the National Cancer Institute and others that talk about the potential for PFAS being cancer-causing agents or carcinogens, especially cancers such as kidney cancer, testicular cancer, and so forth.
So, Alan, since our local PFAS crisis became public several years ago, I've had a lot of parents ask me what they should be looking for in kids who are exposed, and I haven't had great answers for them. What would you say?
Well, it's a good question, and I'm a pediatrician, David, and we don't have all the answers for what parents should look for, or frankly, what their doctors should be looking for. There was a wonderful study that was the culmination of about 2 or 3 years of effort, and that study talked about some of these health effects in children and adolescents, including those that I mentioned, such as effects on cholesterol, effects on lipid metabolism, effects on immune function, and so forth. And so doctors have been encouraged to talk with their patients and talk with their families about their drinking water and the water they use for cooking, and have they received any notices from their town that their municipal water has elevated levels of PFAS. The EPA has set regulations for some of the PFAS chemicals in terms of how much is allowable in drinking water, and if the amount exceeds that water, then municipal water suppliers need to alert their consumers of those exceedances. For those families, there should be a dialogue with their physician on whether or not the family needs blood PFAS levels. You can measure these chemicals in the blood and come to some conclusions as to whether the family is at any risk for a health problem related to their exposure to these chemicals. So that's about the state of the art right now, is just to have a dialogue between healthcare professionals and the families they serve about their exposure to PFAS, about how to prevent future exposures to these chemicals, and what kind of monitoring, including biomonitoring, should be done to follow the family and make sure that they are staying in good health and that their well-being is protected.
So aside from figuring out if your drinking water has PFAS in it, if I have families asking about reducing their exposure to these chemicals, what are some steps I can tell them to take? Should I tell them not to use Teflon pans?
Well, especially if they're older pans and have deteriorating surfaces and flaking Teflon, then they should definitely throw those away. When they buy new pans for cooking, aluminum or iron are great choices. There are newer nonstick pans that are made without PFAS, and it should say it right on the label of the pan that this pan does not contain any PFAS in its composition. So that's one thing they can do. Obviously, if they have old spray cans of waterproofing chemicals, or if they have older waterproofed shoes and other clothing, they may want to dispose of that. Part of the problem, Joanna, is that PFAS, as it deteriorates, can get into household dust. So that's another means of exposure, especially among young children who have a lot of oral behaviors. They crawl around on the floor and they put their hands in their mouths. So they can get exposed to these chemicals through household dust. And in surveys of homes in some towns in the United States, the science has shown measurable levels of PFAS in household dust. So it's another medium that we should be aware of when we're trying to prevent PFAS exposure.
You're making me think of my box of old shoe stuff, and I know that I have one of those cans in there of the stuff to spray on your suede shoes so the water beads up. That can't be good. At the policy level, the EPA announced the drinking water standard very recently, which includes restrictions on the 6 versions of PFAS that are easiest to measure. But do you have any idea about how these restrictions are going to work in practice?
Well, that's a good question, David, and we'll have to see what the rollout is. The EPA has made some excellent progress in its approach to managing PFAS in the country and ensuring the public's health by restricting these compounds and getting more stringent in their regulation of them. And just this year, they passed, as you said, new, very low acceptable amounts of PFAS into law. And this allows them to take some enforcement action against those responsible for PFAS pollution in terms of funding the cleanup of these chemicals in places like Cape Fear, North Carolina, and others that might have been affected.
Yeah, that's us.
But I mean, will these restrictions be enough if there are thousands of these things already out there?
There are many of these products, Joanna, and so this is continuing as an area that we need to work together with our families and be vigilant about. It's estimated that about 200 million Americans are at risk of having water that has been contaminated with PFAS at some level. And so that's about 60% of us in the United States. The Biden administration has, through the Bipartisan Infrastructure Act, given at least a couple of $2 billion to facilitate testing for PFAS around the country and to help in the cleanup of municipal water systems that might be affected. But that's only the beginning.
Is there anything I can do, like a home filter I can buy to make sure that the PFAS is not in the water that I drink from the tap?
That's a great question. And for those families who have well water a reverse osmosis pump and filter will filter out PFAS before it gets into the home. They need to install that reverse osmosis filter and keep the filters changed for that to be effective. Some of the routine filters that are used at the tap or in refrigerators are pretty variable in their ability to remove PFAS. And some of the commonly used point of use filters are not very effective. But the technology is changing, the industry is responding, and there are more filters available now to consumers that do a good job or a fairly good job in removing PFAS from the water.
Well, that at least offers us some hope. Before we let you go, Alan, do you have any last takeaways for our listeners?
Well, I think this is an evolving situation. We're making progress, David, and we need to continue to work to eliminate these chemicals, PFAS, in our environment, and for the sake of our families and especially for the sake of our children.
Dr. Alan Woolf, thank you so much for joining us today.
It was my pleasure.
To learn more about PFAS, go to aap.org/podcast.
Coming up, we'll look at how positive childhood experiences affect the adverse childhood experience of parental incarceration.
Where I work, we think a lot about ACEs, or adverse childhood experiences, but I'm really getting into PIECES more, or positive childhood experiences.
Oh, yeah, like the ones Dr. Bob Segi told us about in episode 11.
Wow, that was a while ago, David, but you're right. And maybe it's because I'm an optimist, but I feel like focusing on the positive is something we all need right now.
Well, then I'm positive you're going to enjoy meeting our next guest, Lilian Bravo, a PhD and RN, who studied here at UNC, where I trained, before joining the National Clinician Scholars Program in the Division of General Internal Medicine and Health Services Research at the David Geffen School of Medicine at the University of California, Los Angeles, where you trained.
Oh, I love all the connections. She is also lead author on a new paper in pediatrics, Parental Legal System Involvement, Positive Childhood Experiences, and Suicide Risk. Lilian, welcome to the show.
Hi, thank you all for having me.
Lilian, we've talked before on the podcast about ACEs and PIECES, or positive childhood experiences, but can you briefly review these concepts for us?
Yeah. So I think that a lot of folks are familiar with adverse childhood experiences, but essentially they're thought of to be things such as household adversity, also physical abuse, emotional neglect, that contribute to toxic stress and then contributes to adverse health outcomes and mental health outcomes such as suicide risk. Increasingly, we're seeing state policies that encourage the screening of adverse childhood experiences. And now in the literature, a newer concept is positive childhood experiences, which are essentially you can think of as the counterpart to ACEs. And positive childhood experiences are thought to be the factors that strengthen resilience, right? And also could potentially buffer the toxic stress associated with adversity caused by ACEs. And positive childhood experiences are also set into domains in a similar way as ACEs are. Specifically, there's 4 domains when looking at the HOPE framework. One being positive and supportive relationships. So having a trusted adult in one's life, for example. Another is supportive environments. So thinking about school climate as well as neighborhood safety. Also social and emotional learning competencies. And then lastly, thinking about social engagement and activities that promote sense of belonging.
Lilian, your study looked at parental incarceration specifically and how it relates to suicide in young people. What was it about this ACE that intrigued you?
Yeah, so to contextualize that, I did some previous work looking at adverse childhood experiences and how that count variable is associated with increased risk for suicidal thoughts and behaviors. And we found a dose-response relationship such that as the number of ACEs increases, so does that risk for ideation and attempts. But it's really not enough. It doesn't tell us what to target within those adverse childhood experiences. And so I knew we had to dig a little deeper and disaggregate by the different types of ACEs. The reason why I particularly decided to focus on parental legal system involvement, specifically incarceration and arrest, was that this is an ACE that disrupts attachment. And we know that those adverse childhood experiences of interpersonal nature are the ones that are associated with increased risk for suicide. So that was one particular reason. Another is when looking at who's at risk for suicide. Historically, Black youth have been at lower risk for suicide compared to white youth. But we're now seeing some alarming trends, such that Black children under the ages of 13 are actually dying at a 2 times higher rate of suicide compared to white youth. And when we're thinking about what factors are Black youth and Black communities disproportionately affected by, parental incarceration and legal system involvement is one of those.
The rise in youth depression and suicide is one of the most alarming trends in pediatrics today. How did you want to investigate this relationship between parental incarceration and suicide?
Yeah, so in order to understand that relationship between parental incarceration and suicide risk, which in our study we defined as looking at ideation as well as attempts and non-suicidal self-injury, we looked to the Adolescent Brain and Cognitive Development Study. It's a longitudinal national study looking at essentially how social and environmental level factors are affecting brain development and health over time for youth. And so within that data set, what we took is a cross-sectional sample of 11 to 12-year-olds, and we ran some log binomial linear regression models to look at how parental incarceration was associated with those 3 different suicide risk indicators. And then importantly, bringing in positive childhood experiences, right? Not only understanding what's contributing to that risk, but what can we do to potentially buffer it? We then added some interaction terms to understand whether the number of positive childhood experiences could actually buffer that association.
And you focused on this one particular ACE. Were there any positive childhood experiences that you focused on in particular, or were you just looking at all of the positive childhood experiences as a marker of resilience?
So we did a count variable for our positive childhood experiences spanning a couple of different domains, but we didn't look at one in particular. So some of the positive childhood experiences included in this study included having safe and supportive relationships with trusted adults, as well as engaging in activities at school and neighborhood safety.
And once you analyzed all this data, what did you find?
Yeah, so what we found was that youth exposed to parental incarceration were at a 1.7 times higher risk to experience suicidal ideation. And we also found that parent arrest was associated with a 1.8 times higher risk to experience ideation and a 2.6 times higher risk to attempt suicide. And then the other part of our study really wanted to understand what could potentially buffer these relationships. And we found that positive childhood experiences didn't necessarily buffer this association between parental legal system involvement and increased risk for suicide, but that they had an independent effect. So positive childhood experiences were associated with around a 20% decrease for suicidal ideation and around a 15% decrease for non-suicidal self-injury.
Wow, that data leaves you with a lot to think about. And I know your study didn't look at interventions, but in your experience, what do you think we can do in practice that might decrease vulnerable kids' risk of suicide?
Yeah, so I think, coming back to the main message of the study and understanding adverse childhood experiences, as other states move to include ACE screening as part of their routine checkups, like California, I think clinicians are really struggling with, okay, what do I do with this now? What do I do if I can't refer them to supportive resources to actually address this adversity that they're experiencing? And I think A part of that solution could be implementing also strengths-based screenings, such as looking at positive childhood experiences. So clinicians can not only, understand what might not be going well in a child's environment, but also what's going well. How can we promote those, protective relationships or positive experiences they are having? And maybe how can we fill in the gaps in places where maybe they aren't reporting positive childhood experiences?
Well, I love that charge for us. We want to make sure everyone reads this study, Lilian, but before you go, can you leave us with one last takeaway?
I think that, the last takeaway is really going back to the screening in terms of what clinicians can do and taking a holistic approach to looking at a child's potential risk for suicide. I know that, guidelines suggest universal screening for those 12 and older, and to take into consideration more so what clinical risk factors are there for those below the age of 12. And I think one of those clinical risk factors really is ACEs. So even if a youth is, under the age of 12 and they are reporting a high number of ACEs or particularly concerning frequency and severity of ACEs, doing a suicide risk assessment could be warranted.
Lilian Bravo, I want to thank you so much for joining us to talk today.
Thank you.
To read the paper, Parental Legal System Involvement, Positive Childhood Experiences, and Suicide Risk, go to aap.org/podcast. At the end of every episode, we like to leave you with something positive or enlightening. We call this segment Say Ah. David, what's your Say Ah this week?
So ever since Abby was a little girl, we would plant these sweet peas in our garden. And every year when they came ripe, we would run out to the garden and we would pick them together and just munch on them right there when we picked them right off the vine. And so every year I continue to plant these peas. And just a couple of days ago, Abby and Julian came over for brunch and we went through our tradition. The peas were perfectly ripe and so sweet. And here's my young adult daughter, very poised, picking these peas right off the vine and eating them with me. And it just warms my heart every year that we get to do this.
Oh, that's such a sweet tradition, I guess.
Yeah.
My say is that I'm very tired, but I'm, I guess, a good kind of tired because we always do a cousin exchange where we take my sister-in-law's kids for a weekend and then she'll take our kids for a weekend. So we just had our cousin's weekend. So we had 6 kids in the house that my husband and I were taking care of and bonding with. And it's exhausting, but it's really amazing to see all the cousins play together and form their own relationships. So we are proud of the tradition of the many children. And I think I'm done having kids, David. I like
they're going to have very happy memories, and you're going to have a few naps ahead of you, I think. That's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on Facebook and Instagram at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producer and editor is Ann Johnsos. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer, and Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson. Join us next week when we'll get the June edition of First Up.
We'll also tell you about a new podcast from the AAP with a focus on parents. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. Thanks for listening.